kicked off Facebook Live like I did yesterday morning. It was kind of one of those things where I got through 16 minutes of class and then my live video ended. So we are at 9:33 a.m. live from Boonville, Missouri. Nice weather today. It's not exceedingly hot. It was like horrible yesterday. So I was reading in the Wall Street Journal, which I do quite a bit, that Pfizer has announced improved a 30% improved profit to July or the end of July. So they are at $33.5 billion in sales of this particular shot that they make. They're in. They teamed up with BioNTech, I believe is the name of it, and they're anticipating that maybe if there's a booster injection involved, that their sales for the year are going to be about $45 billion. So there's a lot of money involved in these injections. About 10 states have less than 35% inoculation. So there's, and I think we're at, I can't remember, 65%, maybe nationwide. So there's lots of potentials. But there is a new shot that is awaiting approval. I think they just applied for it maybe this week or at the very end of July was the plan from Novavax. And this one actually makes more sense to me because the other ones are kind of based on newer technology. So at the end of January, there were reports of an inoculation that had succeeded in clinical trials, about 70% protection. That was front page news in the US. Lots of push alerts on phones. But when Novavax announced their stunning trial results in June, there was hardly a bleep. Like I had a client of mine pointed out to me, which is why you're getting this class. So I do get ideas for class from you all. So keep in touch and let me know what you want to hear about. So stunning trial results. It was published in the New England Journal of Medicine, I think in May, and then a press release or something in June, I believe. Efficacy rate of 90% even against variants. Okay, the difference being timing. So we already had 3 vaccines that were authorized for emergency use by the US FDA, USDA and the FDA. And so really, the New York Times put that as the nation is awash in other shots. So that's kind of true. So the FDA is not really seeing any urgency to approve anything else. And there are a variety of injections that are in development. This one has gone through phase 3 clinical trials and published their first results at 96% efficacy, and also 90% efficacy regarding viral variants. So it may not be available for several months. They're hoping within 2 months. They've pledged, I can't remember, 100 million doses to be available by the end of the third quarter, which would be the end of September. And so right now we have a national supply of other doses that exceed demand. And so there was lots of hype regarding the early bird shots from Pfizer and Moderna. And so it was hyped. Those two were hyped as the triumph of messenger RNA. So it was a brand new vaccine technology with a potential that stretches beyond this pandemic. So we, trying to get this figured out, we've learned a lot about viruses and inoculations, etc. And then it's been, the quote, a turning point in the long history of vaccines and changing biotech forever. So it appears from all this reporting that the messenger RNA shots have been proven to be the most effective ones you could get. They were better, sleeker, and actually kind of cool to take. So That's a fascinating thing, but there's a huge amount of hesitancy because it's brand new technology. So the shiny options of the media exposure have obscured some facts. So these two particular messenger RNA shots were the first to get results from phase 3 clinical trials based on superior trial management. So they don't have anything specifically secret or whatever. It was trial management. So these shots are harder and more expensive to manufacture and distribute than the traditional types of injections and inoculations that you get in your childhood. The side effects are more common, they're more severe, and then the latest data from Novavax confirms that it's possible to achieve the same efficacy against this virus with a more familiar technology that more people may be inclined to trust. So feeling more trustworthy because this particular type of vaccine was first developed for the hepatitis B vaccine, which I received, and that was released in 1986. So there were 3 shots involved in that over 6 months. I got all those in residency in the late 1980s at the University of Nebraska Medical Center. It wasn't required, but since I was exposed to so much blood as a surgeon, I felt hepatitis B vaccine was important. So the messenger RNA vaccines, the other two, Moderna and Pfizer, are delivering efficacy rates of 95 and 94% against the original viral strain in phase 3 trials. Novavax was 96% against the original strain and now is reporting 90% effectiveness against a mixture of variants, which is the big thing in the news is the Delta variant. So inoculation success really never about technology. I got this class from The Atlantic, nice little article from July, or actually June. So you have to have a massive clinical trial operation going on, and it had to be situated in places where the virus was spreading widely at the right time. So even if your injection worked well, if you weren't testing in the middle of a huge outbreak, you'd have to wait a long time for evidence to show that you had efficacy. And so the timing of the studies for the Moderna and Pfizer vaccine mattered a great deal in practice. So the phase 3 clinical trials for those two were up and running by the late summer of 2020 during a national giant wave of infections in the fall. By the time Novavax had finished recruiting in the US and Mexico in February of 2021, case rates had been, or 2021 case rates had been dropping. Now they're rising again. So this fact alone, independent of the technology of any inoculation, did a lot to shape the outcome and what you've heard in the media. And then there was corporate strategy. So everybody's trying to win the vaccine race. So you had to have a high quality vaccine that's reliable and can be made quickly and in vast numbers. So it needed to field the challenges of working with multiple regulatory agencies around the world, and all of that would have to occur same time. Happy Friday, Eileen. Thanks. Hope you're enjoying this. I think this is kind of important stuff, given the hesitancy that we have around the country. So Pfizer teamed with BioNTech, which is a German company, to develop the messenger RNA shot. So they couldn't do it by themselves. It was a team effort. So last October, BioNTech reached out to Pfizer for help because of the scale of the clinical trial program necessary to get drug approval. And basically, it wasn't just the triumph of the messenger RNA, it was the strategic partnership. And then Moderna had the advantage of partnering with the National Institutes of Health. Okay, so BioNTech Pfizer first in human injection study appeared on the US government's registry on April 30th of 2020, the same day as the first in-human study for Novavax, who was going to be going alone. They did receive funding, $2 billion, $2 billion as a B, to help them do it, but they didn't team up with anybody. If they would have paired up, let's say, with another huge pharmaceutical company, they may have been first to market. So pretty much the early success to the two first messenger RNA shots pulled attention away from some of the slower progress of other candidates that was based on the same technology. So just 2 days after the Novavax announcement came the news that the messenger RNA vaccine developed in Germany called CureVac had a weak efficacy rate. It was a surprise to the scientists that developed it, according to the New York Times. And so CureVac is the company that President Trump reportedly tried to lure to the U.S. early in the pandemic, and one that Elon Musk said he would supply with automated RNA microfactories. So really, the struggles of that particular injection illustrate what is known in epidemiology as a survivor bias. So it's to look only at positive examples and then make sweeping conclusions on that basis. So when the first two injections triumphed, the Washington Post suggested that a bet on speedy but risky messenger RNA technology had paid off with a paradigm-shifting breakthrough in that technology. It was called a spectacular success by a certain famous doctor. So analysts usually had less to say about the non-messenger RNA shots that had gotten into clinical trials just as quickly, and about the other messenger RNA shots that were hitting snags along the way. So now that you've seen that CureVac from Germany had less efficacy and some messenger RNA formulations worked better than others, there were 9 groups testing those types of shots in animals as of May 2020. 6 were expected to be in clinical trials a few months later, and by the end of the year, only BioNTech, Pfizer, Moderna, and CureVac had reached phase 3 testing, in contradistinction to 13 non-messenger RNA injections. So of the 9 messenger RNA inoculations that were already tested in animals in mid-2020, just 2 have proved efficacy at this point, while no fewer than 9 vaccines based on more traditional vaccine technology have reached the same mark in clinical testing. So the other non-messenger RNA inoculations have been widely used throughout the world, and some could still make an important difference here in the United States. So there's plenty of doses, depending on where you're at, of the Pfizer and Moderna injections right now, but the demand has gone down because of the hesitancy. So there's 10 states with fewer than 35% of American adults that have had these shots. And there was some misinformation about genetically altering your DNA and making you genetically modified as a human being. There's no evidence of that. And then there was some evidence or concerns about tainted doses made at a Baltimore factory, and then the emergence of a rare but serious side effect. And some of the side effects and some of the clients I've heard from or seen people tell their stories have been kind of hinky. I mean, just like really spooky stuff. So this Novavax thing, I think it's Novavax is who makes it. Should be like all over the news. You got a non-messenger RNA option, and so the recent results in June confirm that it has the same efficacy as the other 2 authorized emergency use messenger RNA shots, with the added benefit of being based on an older and more familiar type of science. So the protein subunit approach is what's in the Novavax injection, and that was first implemented in 1986 with the hepatitis B vaccine. It's also used in the pertussis vaccine. So some of the people who have been wary about getting the messenger RNA shot may find Novavax injections more appealing or more trustworthy or less maybe dangerous. It has reportedly, what they're reporting, a substantial lower substantially lower rate of side effects than the authorized new messenger RNA vaccines. That's new technology, never been used. So about 40% of people who received the Novavax reported fatigue after the second dose. So it's 2 injections, as compared to 65% for Moderna and more than 55% fatigue for the Pfizer injection. And based on the results of the Novavax first efficacy trial in the United Kingdom, side effects including but not limited to fatigue aren't just less frequent, they're milder. So that's a big deal for people that are on hourly wages, is what this reporter in the Atlantic talks about, because people, they don't want to have prolonged side effects and have to not be able to go to work. So they've been less likely to get vaccinated, in part because of the risk of losing days of work, since they're on hourly wage. They're not on a contract. They're not on a set amount of pay per pay period. And so side effects is a big barrier for these shots being accepted as a reasonable thing to do as far as this type of injection and inoculation. So only about half of adults, this is going back late June from the CDC, half of adults under the age of 40 have gotten this injection or definitely intend to do so. And then 56% say they're concerned about side effects. And so lower rates of adverse events are likely to be a bigger issue even still for parents and pediatrics, since they're thinking about inoculating their children. So the 2 vaccines that are based on newer technology have been shown to reduce your rate of death and hospitalization. That's about it. We're still hearing that you can get this virus even though you've been inoculated, and that's true. The University of Missouri got inoculated in January. Got coronavirus in March. Kind of the same kind of, and she's had it twice before that. And so even the best experts at predicting which drugs are going to be important get things wrong occasionally, overestimating some treatments and underestimating others. So pharmaceuticals is kind of a gamble. And then you have, if you remember my lecture on Lipitor, you have scientific evidence back in the 90s that was suppressed. They just dropped it out. That's scientific fraud, basically. So here's what we know today. Based on the information right now, and this is from the guy that wrote the Atlantic. Oh, it's not a guy, sorry, Hilda Bastian. So this is her words, direct quote. I'll give you her very last. School vaccine from Novavax combines the ease of manufacture with high efficacy and lower side effects. For the moment, it's the best COVID-19 vaccine that we have. She's a scientist, was an editor for PubMed Health Projects at the National Library of Medicine. So good little article I thought I'd share with you as we're talking about what you should do. New inoculations that are using technology that's never been used, that seems to be the hesitancy. And also the side effect profile, which is right around 50%, if not more. Well, higher with the Moderna one. So that's the newest and latest on shots and pokes, if you're considering. So hopefully that gives you food for thought. It's not on the market yet. You can't get it yet. They're waiting approval from the USDA and FDA. So talk to you later. That's the end of class for today, and have a good weekend. I'll see you Monday from the Lake of the Ozarks. Bye.